Hi, I'm Dr. Julie Nelson, and I am a doctor of traditional Chinese medicine in Vancouver, British Columbia. Today, we're going to discuss why we need to pay attention to trauma and why it is creating such a big health crisis. And if you find this video interesting or helpful, please consider subscribing by hitting the red button below. Trauma is the smoking gun in the room. It has the ability to kill people. Not outright. It's more like a stealth killer that over time waits for people's immune system to wear down, then it attacks. It attacks by weakening their immune system. When people are in a state of stress, especially high stress, it signals the release of proteins and other chemical systems into the bloodstream to promote the resistance of infection. In other words, the body gets ready to repair any tissue that might be damaged during the flight response sequence. It's important to note that your body cannot discern between a knife attack and a sexual assault. To your body, an attack or perceived attack is all that it needs to get ready to start repairing you. It's like your body sets up a mini triage in case you're injured, which is great. And once the threat disappears, this inflammation response subsides. But what happens if you stay in a state of high anxiety? Your oh so efficient body keeps releasing more and more proteins, getting ready for an injury that never happens. It's stockpiling ammunition, waiting. And what happens is this overstockpiling of proteins and chemical responses actually causes a toxic effect on the heart and other organs. The impact on your body is worse the earlier the trauma, childhood abuse. The longer the trauma goes on for, the greater the damage to your body, and especially as you age and the trauma signals don't get turned off. Researchers have found that adults in their 30s who grew up in abusive homes were nearly twice as likely to have elevated levels of inflammatory proteins in their blood, what is referred to as sensitivity C reactive proteins, than their peers who were not mistreated. Rheumatoid arthritis and other autoimmune diseases, and when we look at rheumatoid arthritis, what happens is your immune system is attacking the healthy cells in your body by mistake. And so the result is you get pain and swelling in your joints, knees, elbows, jaw, and even in your eye, called uveitis. The way you diagnose rheumatoid arthritis is by testing to see if there are high levels of C-reactive proteins in your blood. See the correlation? And another study that was done on incest survivors found abnormalities in their CD45 RA to RO ratio compared to their non-traumatized peers. So what happens is the RA cells have been activated by past exposure to toxins, and they quickly respond to environmental threats that they've encountered before, kind of like the killer T cells. The RA cells are kept in reserve for new challenges. They're activated to deal with threats to your body not yet met. Remember, when your body is under a perceived threat, all kinds of chemical reactions are happening in your body, usually at the blood and cellular level. The RA to RO ratio is the balance between the cells that recognize known toxins and the cells that wait for information to activate. In patients with histories of sexual abuse, the proportion of RA cells that are ready to pounce is much higher than normal levels. In other words, they've been stockpiling. This makes the immune system oversensitive to threats so that it is prone to mount a defense when none is needed. Autoimmune diseases are caused by the body attacking its own cells. Incest victims, like every other victim of abuse, have trouble basically discerning danger from safety. Past trauma distorts our view of the world. In other words, the world is not a safe place to be. And unfortunately, these victims don't know how to feel safe, and as a result, their body is constantly ready for attack. So it's mounting a defense. It gets worse. So these same mistreated, abused children grow up to be adults, and they are 3 times more likely to experience major depression by their 30s and are twice as likely to have elevated risks of heart disease. Trauma causes changes in blood chemistry, our cells, and also our brain. And researchers have found that repeated full-scale activation of the stress response system, especially in early childhood, can lead to deep physical changes to the brain. Early childhood adversity actually alters the chemistry of the DNA in the brain through a process called methylation. And basically, traumatic experiences can cause tiny chemical markers called methyl groups to affix themselves to genes that govern the production of stress hormone receptors in the brain. It disables these genes, preventing the brain from properly regulating its response to stress. The brain becomes unable to turn off the stress response. Studies have shown that different forms of abuse will have different impacts on various parts of the brain at different stages in development. So, interesting enough, yesterday in clinic, I had a patient, Stephanie, not her real name, who I regularly treat for trauma. She came in to see me, and we weren't treating something. When I treat her, I'm not treating something specific to trauma. It's more to keep her balanced and regulated. So yesterday she came to see me because after spending a few days in the hospital, she was basically hospitalized because her Bartholin's glands had formed a cyst. And she's had this cyst there for probably the last 7 or 8 years. It formed after she had had a very abusive and sexually abusive relationship, and the cyst formed, but for the most part was kept at bay. And if you don't know what you basically in women have what we call Bartholin glands, and those glands produce lubricant that keeps the vagina moist. So just on the side of this gland, she had formed a cyst. And what had happened was she had gone to have a pap test done by her doctor, a woman she trusts. And the challenge, though, is the doctor performed the pap, but Stephanie wasn't prepared for it. Mentally, she wasn't prepared for it. It was sort of a surprise. Hey, we should probably do this. And what happened to her is it triggered her trauma response mechanism. And so even though a medical doctor performing a medical procedure, to Stephanie, her rational brain was unable to override her emotional brain. And so her response felt like it was another sexual attack, a sexual assault happening to her, even though it was a medical procedure. What happened was she had the pap test done, and 2 hours later, her Bartholin cyst had swelled so badly that she had to go to the emergency to seek medical attention. She was hospitalized. They had to basically cut into the cyst. They had to remove the abscess and catheterize her. Her white blood cells were way up. Basically off the charts. Her heart rate was off the charts. This was a trauma response. You could tell that the proteins were pouring into her bloodstream. They were elevating her blood levels, her white blood cells to respond to an inflammation, to an attack. And as a result, the abscess just went from a very small, or the cyst went from a very small pea size to a very large and required medical assistance. So this is an example of what happens, and this is a very dramatic example of what happens when we go into a state of, when we're re-traumatized. I guess that's the best way to describe it. And as I say, like, it was not a simple pap test basically demonstrated how her body responded to stress. Her immune system went into overdrive, and it's no coincidence that where the trauma occurred, this is where the cyst formed. So, and over time, our cellular structures change if the inflammation response is not turned off. And it was interesting because later that same day, I would see another young woman, a personal trainer, who came in to see me because her jaw was so tight from clenching and grinding that she was getting headaches. And she wanted to see if facial acupuncture could relieve some of this pain and tension caused by clenching and grinding. And as I say, it was really, really tight here, and she was also getting headaches here as a result of these muscles being so tight. So what was interesting is when we started doing her health history, it turned out she was also being treated for ulcerative colitis and was on medication for this. She was diagnosed with asthma last year. Now, at this point, when I start to hear ulcerative colitis, clenching and grinding, and asthma, a recent asthma diagnosis, I paused and I looked at her and I said, hey, any history of trauma in your family? She rolled her eyes and said, oh yeah. She said, my mom died when I was 10 years old. Now, mom died of cancer. And prior to this, she had had a very healthy, stable family home. But after the death of her mother, it changed everything for her. And it wasn't that her father became abusive or anything. In fact, he was very stable, and she went on to graduate from high school and went on to university and got a job. But the problem is she got stuck in the trauma. Her body is not in a state of what I call regulation or balance. And the reason we say that is because when you start to see autoimmune diseases, ulcerative colitis, right? That's an inflammatory bowel disease, right? Not IBS, but it's inflammatory. She's on heavy medication for that. She gets shots every 8 weeks to manage the inflammation. And so for her body is still bearing the scars of the shock trauma. And it's a classic case of her body being stuck in the flight mode. She's happy, she holds down a good job, but her persona is, I need to keep moving. And how she manages her anxiety is by moving. And it's no coincidence that she's a personal trainer. So our goal in this treatment was to get her to a point where she's out of flight mode, and to regulate her body. So when her gut settles down, the inflammation in her gut will settle down. When she feels safe and she's no longer in that flight mode, then her digestive system should start to be returned to normal. And so it's funny because I do these videos and I talk about this all the time, and then right in front of me is a classic example of somebody who at a young age got stuck in flight mode and hasn't come out of it yet. And now the body is starting to respond by wearing down. The inflammation is occurring in her body. And so what we did is we addressed it, we talked about it, said, hey, here's what I think is going on with you. And then we got her on the table and we did acupuncture, obviously to treat the jaw. So I do a lot of facial acupuncture. We'll put a lot of needles in the master muscles and all in here. And then I held her feet and did healing touch on her. And it was interesting because she was like, wow, that really just felt like energy was just like slowly draining out of me. And it's not so much the energy is draining out, it's that we're basically relieving the excess energy, the fear, the trauma, the shock, and getting her back to a state of regulation. So it's going to be interesting to follow this patient because she's great, she's young, she's healthy, and my goal is that we will eventually get her off the medication and get her gut restored to normal digestive function. So I'm Dr. Julie Nelson, and thanks very much for watching.